This is another unique idea about using wide field angiography using RetCam3. Why we did this study predominantly because we acquired this new machine, and even though we were using it for our pediatric patients, we realized that most of the time it was going underutilized. So we started imaging adult patients with this disease, and to our surprise and happiness that many new findings came up. So that is how we designed this study. So coming to the presently available modalities of treatment, we have optos, which I feel is the gold standard as of today. And we also have Heidelberg, Claris, use of Storangi lens along with the Spectralis. And the RetCam device works very well in pediatric cases. So the RetCam can image up to periphery, that part all of us understand, but the adult eyes are not same as infant eyes. This is what I realized for the first time when I used the probe on adult. And if we are able to prove that RetCam technology is also useful in adult population, we are having quite a number of inexpensive variants for neonatal periphery imaging coming up. And probably the use of ultra-wide field angiography using these pediatric retinal imaging devices can help us percolate the usefulness of wide field imaging to the community. So my journey started with this thing when I was a primary ophthalmologist, not trained in retina, and I wanted to look at the periphery. Using my slit lamp and a cobalt blue filter, I started looking at the peripheral retina using the digital wide field lenses of both. But what interested me after being trained in retina and ROP for a small bit was that RetCam was a device which had a very proven role when it came to pediatric retinal disorders. Almost for past 2 decades, we all know that you can study ROP with this particular device. This is the standard pediatric imaging at our place where you can easily follow up your cases using this device. You can add on some additional laser in these skip areas. And this device, since it's there for most of the time in your OPD and is getting underutilized, people have started using it in other indications. From the reports of gonioangiography way back in 2013 to people using it for studying the choroidal tumors and Coats disease. So what happens when you use this particular device in adults? So compared to the previous images that I showed you, when you're using these images in adults, number one, the clarity of the retina is not so great. This is what I realized, that would come whatever lens I was using, 130, 120, 80 or 20, 30 degree lens. The blood vessels, they're not extremely clear. Only in few views you get them as nicely as a pediatric image. This has something to do with the architecture of a pediatric, that is the infant eye compared to an adult eye. And though the aura can be easily viewed in a neonate, it's not so with an adult. You require quite a lot of effort. Maybe that also has something to do with the increased rigidity of the sclera in these adult patients. And though people may say indenting is an option, it really does not work in clinic. So this is a standard case where we saw that, again, my favorite, retinal vasculitis and uveitis. So this was a standard FFA capture. And these were the additional findings that we were getting on our RetCam device, the same patient I had used. And we realized that there was a discount on the clarity of the blood vessels in the periphery when we were imaging. This had to be balanced from the field of view. So we designed this study where consecutive patients, while they were undergoing a standard FA angiography on the Zeiss FF450, 2 minutes after the dye injection, when the initial images were captured, the patient was made to lie supine, and we were capturing the RetCam 130 degree images. So we were not capturing the early phase images, but we were capturing the mid and late phase images in most of these patients. And very simple study, 68 patients total for whom I have done this kind of study. And the RetCam imaging added new findings in my patients that were 55. So 55 patients out of 68 is quite a large number. And did it really change my treatment decisions? Yes, in 26 patients, though the principal modality of treatment remained same, but the decision of adding laser in the periphery, or for a patient to assess whether a complete remission of uveitic activities has occurred, these treatment decision changes did occur after using a RetCam. So this is the breakup analysis of all the patients that we studied. Most of these patients were diabetic retinopathy patients, and the new findings that we were observing in the periphery were mostly leftover CNP areas. Today, we all agree that a scatter laser should be carried out beyond the equator till the aura also if you have CNP areas. And those were the areas that we were seeing, and we were directing these patients to laser therapy. And in 8 such patients, we changed our decisions. Similar was the case with retinal vascular occlusions that we saw. And the principal changes which occurred were in the retinal vasculitis and intermediate uveitis group. Principally, why? Because we were adding laser to the patient based on the peripheral findings. And also after seeing peripheral disease activity, we were increasing the duration of our immune suppression. That even though the central macula will look quiet, the disc will look quiet, sometimes you have residual activity with vasculitis in periphery, and you may think about prolonging your treatment. So take-home message is that it can successfully image the periphery in adults, and 120-degree lens is better than 130. 130 is not the best lens. The details are not good for publication purposes. Please don't try it. The images are not extremely clear. And the hyperfluorescence of NV leaks and active vasculitis is what you pick up, and the hypo CNP areas. Thank you so much. Any questions?
Dr. Pradeep, do you have access to other wide-angle imaging systems in your clinic?
Yes, sir. We have access to Optos imaging and Spectralis, 2 other imaging devices we have.
So if you have got Optos, what was the impetus to, because with Optos the images clarity is much better. Even with this Spectralis, we can get a wide angle imaging where the image quality is excellent. So what was the impetus or thinking behind going for this study, which looks little cumbersome for the patient to be made supine again? Or is it just you want to explore the machine a little more?
Okay, sir. So we purchased about 7 such machines in Army setup. And only at one setup where I am sitting, all the other wide field imaging devices are available. But rest of the 6, the machine is lying there, a RetCam machine, but they don't have an Optos or a Spectralis. So here we had a situation where these patients need to be transferred from other cities right across the country to Delhi to simply get a wide field imaging done. So we wanted to devise a protocol for our other centers that you can take these images, send them across to us, and it saves the travel time of the patient. Especially this study came up in COVID times when there were restrictions on travel of patients, and there were patients who were sitting in peripheral areas where a RetCam device was available. And we were trying to instruct our ophthalmologists there who are not retina specialists to click these images and send across. That is where the idea came from.
Okay.
Dr. Pradeep, I think good idea to try machines for multiple purposes. But I would just like to caution you here that since you feel the image quality is not good, I think you have not shown us also some of the peripheral images. Exactly. So sometimes the blur itself might give you a false impression of activity. So you should compare it with the UWFA and actually determine whether it was true activity or it was a blur which was making you feel that there is hyperfluorescence around the vessels and false indication of activity.
Very valid points, sir. I'll keep it into mind. I think next time I'll compare it with the Optos. It has come recently joining us, so we'll do that study. Right.